Welcome back. It is 9:15. Mother's Day is coming up on Sunday. May is also Mental Health Awareness Month, and so this morning we're focusing on mental health support for new mothers. Licensed mental health counselor Shantala Boss is here this morning. Shantala, it's good to see you. I feel like it's been forever.
I know,
since we have
been a minute
together. You know, we talk about mental health, but for new moms, it really is especially important because they're entering kind of this whole new territory, right?
It's a total life change in so many ways. So it's so important to really focus on mental health for new moms. You know, there's a 15% of women that are pregnant struggle with mental health problems, and almost 20% postpartum struggle with depression, anxiety, baby blues, which is pretty normal, but a good amount of women do struggle with the really severe anxiety, depression, some things just because of all the life changes, events, hormones, situations. So it's so important, I really think, to get ahead of that. If a woman is wanting to get pregnant or planning on getting pregnant, seeing a therapist, just talking about things.
Even before pregnancy.
Before pregnancy.
Why is that important?
That's so important because there's such a more higher risk for dealing with postpartum depression if you have anxiety or depression any time in life beforehand. So if you ever have any mental health concerns, it's so important. And even if you don't, any average person that doesn't have any mental health concerns with such a huge life change, lack of sleep, all these new schedules, that's going to really take a toll on a person emotionally. So learning coping strategies of how to set boundaries, find support networks, systems, open communication with your partner, because it also can take a huge toll on a relationship, even if you have the strongest of relationships. So it's really important to get ahead of that.
How do you know if it's just I'm overwhelmed because I'm a new mom and I'm dealing with all of these things and it's something more serious? Is there a distinction between those two things?
Well, there is. You know, all of us are going to struggle with some things when we're going to be a new mom or having a new change, but if it's 2 weeks or more, if it's continuing and it's getting heightened to the point of extreme mood swings, irritability, depression, withdrawal, people are saying things, concerned about you, those are the times where it's like, okay, I need to really look into this and seek some treatment. It's so easy to do. There's so many resources out there.
And don't be afraid to seek treatment.
No, and I think the other problem too is moms feel guilt.
Yes.
Because they're having these thoughts. Sometimes they're intrusive thoughts. If they're struggling with postpartum, they can be obsessive thoughts. They can be thoughts about self-harm. And so they don't want to talk about it because they feel like something's wrong with them. But it's just like anything else, like diabetes or cancer. You're dealing with a situation mentally that is typical for a lot of women. There's so much research. And so not feeling guilt or shame or blame and realizing that it's normal and it's okay.
You know, sometimes that guilt and shame and blame can, manifest itself and turn into something a lot more serious, right? So I can't help but think about the Miss USA, who unfortunately ended her life because she was dealing with a tremendous case of depression, and the only person who knew about it was her mom, right? And so what would you say to not just pregnant women, but other women out there who are dealing with stress, what I like to call high-functioning anxiety, because you don't know, because they're doing everything right, they're so high achieving, they're doing all these amazing things, but underneath it all, Shantala, they are severely depressed.
Well, women are pleasers. We're doers and pleasers, and we're caregivers. And sometimes I think we forget ourselves in the process. And for other people to do well, for our children to do well, we have to feel good. And that's what I tell my parents and my moms all the time. You have to take care of yourself. Also, your children are following you. You're their example. So it's so important that we remember that, and we remember our health, because we forget it so often. And in the case with Miss USA, it's the same thing. The whole world was looking at her. She's trying to please everyone. That's a lot of pressure to put on any person. So not being ahead of it.
Especially if you're already dealing with something.
Exactly. That makes it so much worse.
All right. Really good information, Shantala. Wish we had more time, but thank you so much for being with us this morning.
You today.
You as well. Good conversation. It is 9:20. Stay with us. We'll be right back.
I'm Luann Sorrell.